Hello everyone and welcome back to the channel. Today we are discussing a critical topic as it can easily present with life-threatening weakness or respiratory failure, and that is neuromuscular disorders. We will be referencing Rosen's book of emergency medicine to break down this in a practical and a high-yield manner. Neuromuscular disorders are those that affect the nerves, muscles, or the communication in between. The key players or the key diagnoses are myasthenia gravis, botulism, tic paralysis, and inflammatory disorders. Let's break these down one by one. Myasthenia gravis is a disorder that is characterized by ptosis that gets worse by the end of the day, diplopia, dysphagia, but the hallmark symptom is fatigability and muscle weakness. Myasthenic crisis, on the other hand, is respiratory failure that requires mechanical ventilation. It is usually triggered by infection, stress, or certain medications. It is unlikely for a patient to be newly diagnosed with myasthenia gravis in the emergency department, but if they present, then we diagnose them based on history, clinical findings, serology, and EMG. There is a quick bedside test that has been described in the literature. It is called the ice pack test. Basically, when a person presents with ptosis, if you put a pack of ice on their eyes, it should improve it, and if it does, then this basically signifies that the person has got myasthenia gravis. In the past, we used to do this test called edrophonium test. Today, it is an outdated practice, an outdated test because it has a lot of false positives and false negatives. Serology testing can be positive in about 80 to 90% of the patients. But the key principle to managing these patients is having a lookout for their ABCs, in particular their airway. Consider use of BiPAP if their muscles are fatiguing, but if there is a risk for them to deteriorate, then consider early endotracheal intubation. If they come in a crisis, then we usually do plasma exchange or we give IVIG in the dose of 2 gram per kg, and we consult neurology early and have them on board. But if they're not in crisis, then the ambulatory management for myasthenia gravis is often oral pyridostigmine. It is important we be aware of its adverse reactions. So this drug increases cholinergic stimulation, right? So it puts the patient at increased risk to having airway secretions and increased bowel motility. Moving on to the next disorder, which is botulism. So we know that it is a toxin mediated illness, usually from canned fruits or wounds. And the interesting feature about this is that it causes a descending paralysis. Usually, it is caused by Clostridium botulinum with bacteria, which is an anaerobic spore forming bacteria. And once again, the treatment management in this case and our priority is the airway, then we give supportive care. There is, however, an antitoxin that is available in the US for non infant botulism, but it may not be present everywhere. Next, we have tic paralysis, which is basically an acute ascending disorder, and it starts 1 to 2 days after the tick gets attached to the body. So it's important we remove the tick and we give them generally a very supportive care. And finally, inflammatory disorders. So we're basically talking about dermatomyositis and polymyositis, both of which are proximal muscle weakness disorder. Dermatomyositis has an additional finding of skin manifestations. So One of the most common type of manifestation we see is actually a heliotrope rash. Usually it is very photosensitive. The diagnosis of inflammatory disorders can be made with the elevated CK level, but a normal CK level does not rule it out. We have to do EMG and muscle biopsy to be sure. The treatment is oral prednisone 1 to 2 mg per kg per day. If we talk about general management guidelines for all of these conditions, then remember, as we said, ABCs, but airway comes first. Keep an eye out because you may have to intubate early. Second, taking a good history is very important in these set of patients to ask them about the progression of their weakness, ask them about recent infections, any toxins, canned food consumption, trauma. Exam, we are going to be looking for any attached ticks on the body. We are going to have a look at their reflexes and compare, is this a proximal muscle weakness or a distal muscle weakness, which may change our diagnosis and management. And as we said earlier, we will consult neuro quite early on and have them on board. So to recap and to summarize this video, myasthenia gravis, fatigues, botulism, descends, tic paralysis ascends, and inflammatory disorders weakens. With this, we come to the end of this very short video. Make sure to like, share, and subscribe to the channel for more such content.